Dr. Kumar Angadi, MD Pediatric Endocrinology, NMO General Secretary, All India. Lieutenant Colonel Dr. Ravi, retired MBBS, MD, Assistant Professor in CMR Medical College. Served in Indian Armed Forces at various locations. Doctor Nayan Sriramula, Head of Department Emergency Medicine and Trauma in Medicover Hospitals, Hyderabad. Doctor Prashant Kokivarsar, Professor, Department of Community Medicine, Mallareddy Institute of Medical Sciences. Doctor Akila, Saha Vidyarthi Pramukh, NMO Telangana, PG Community Medicine, GMC Siddipet. Dr. Saideep, Vidyarthi Pramukh, NMO Telangana, Senior SR Orthopedics, GMC Karimnagar. Let us dive into our session. Make yourself comfortable, and if you have any queries, please ping in the chat box. We will begin our session with an introduction by Dr. Kumar Angadi ji.
Good evening, everyone. Respected guests today, the guest speakers, the faculty members, and my dear members of NMO Telangana State Branch, all the office bearers of the NMO Telangana, uh, Saideep, Dr. Saideep, Dr. Akhila, all the students who have gathered here. It gives me immense pleasure to join you people on this inaugural session. This is the first session, I suppose, of the research initiative, learning initiative, the teaching initiative that NMO Telangana has started. So I want to congratulate the NMO Telangana branch office bearers, all the state office bearers, especially Saideep, Akila, Dr. Surendra, Dr. Shankarji, and Dr. Srinivasji, and all the research faculty members who are going to be with you. And what I have learned is this is not just going to be a one-time workshop kind of a thing. This initiative that has been started by NMO Telangana, they're going to take it to the logical conclusions at once in a while, like once in a month or a week, depending on the convenience of the organizers as well as the trainees. They're going to conduct different workshops with a different theme. That after the end of this academic event or the series of events, medical students should be able to understand what is research, draft some protocols, learn research methodologies, different types of researches that has been conducted. So it's not just a one-time workshop. It's going to be a continuous process so that you'll be enabled to take up some small minor research projects. So what is the importance of this research, aptitude and attitude among students? I want to share my own experience during my MD period when I was posted in demands for peripheral postings in neurology. At one day, I being in the branch of pediatrics, so multiple sclerosis is one of the diseases which we see commonly. Uh, Myself and Dr. Arun B. Tally, you can just Google his name. He's a doyen in the field of neurology. He was a professor and unit head there in Imans. We were attending a session on multiple sclerosis. A lady from Germany was teaching all of us on multiple sclerosis. Uh, she spoke in length about multiple sclerosis. After the end of the session, I asked Madam, how many cases of multiple sclerosis you have seen in your life? She said 3 cases. Professor Tally would have seen at least 3,000 cases, and I during my MD period itself had already seen 4 or 5 cases during the period. But this lady, just by seeing 3 cases, she's teaching the whole world about multiple sclerosis. And we Indians, with so much of clinical material with us, we are learning from them, because the basic aptitude of research, academics, teaching, this is somehow lacking. I do not say lacking in interest or lacking in capability. Lacking in orientation is what is there, which is missing. The orientation towards uh, research and academics is missing. I'm glad NMO Telangana has taken up this initiative to introduce that aptitude in all the students right from your beginning days. During most of you are MBBS students, I suppose. During your beginning days itself, NMO Telangana is introducing you to this field of research. So I once again congratulate NMO Telangana team. And as you all know, being the members of NMO Telangana, NMO focuses on all-round development of students. It's not just about academics, it's about their personality, their behavior, their attitude towards the society and themselves. So when we say all-round development, research aptitude is also a part of that all-round development. So I wish NMO Telangana all the best, and all of you all the best. And I hope you will be benefited by attending these sessions. As I said, it's going to be a series of sessions. So wish you good luck, and I thank NMO Telangana office bearers for inviting me to this program and being a part of it and sharing my views. Thank you once again, and all the best to all of you. Over to the organizers and coordinators.
Thank you, sir, for saying. Now, Dr. Ravi, sir,
Good evening, everyone. I'm Dr. Ravi. I'll be talking about the basics of research methodology. Is my screen visible?
Yes, sir, it's visible.
So yes. So the goals of scientific community is, given on the slide. But the most important thing that as medicos, we all should remember is to compare apples with apples and not with oranges. So what is research? Research is a systematic investigation which generates a new knowledge, which in the field of medicine addresses clinical or public health questions. Now, before I go further, I just want to show the screenshot of this article, which I was also an author of. So each article or journal article which we have has got something called as a DOI number. Okay, this is digital object identifier, which will, it is like a URL for your thing. So yeah, you first get, if you do an original research article, you got something like this with the title, with the authors, and you see any author with an asterisk mark, he would be the corresponding author. So now, why research in medicine? I'll get back to the thing again. So now let's think of why research in medicine. So it improves patient care. All of us are aware of the history of scurvy, right? So how a naval doctor treated scurvy on board with feeding the sailors fresh lime. So at that time, there was no formalized way of doing research. You can say it was a research, a medical research in its crudest form. Okay, now it builds evidence-based practice. Now we come back to the history of scurvy. The sailors had scurvy, they have been fed fresh lime in their rations. Now it has built evidence that scurvy is treated by feeding on fresh lime. So it has advanced the science and enhances career development. Now, what is this? Out of sync with this. So just imagine at that time, a doctor who knew how to treat scurvy was better than rest of his counterparts. Now, if we extrapolate it, or if we think of it in today's times, if you have a research bent of mind, you improve the patient care, build evidence-based practice, you have helped in the advancement of science, and that carries your name forward. Just like Dr. Kumarangedi has said, that we have so much of data lying around us, so much of places where we can do research, but the mint of mind is not there. So to develop that, we should understand one thing. What is a triad of research? So all of you must be aware of the epidemiological triad, right? In a similar way, there is this triad, okay? There is a research problem, there is data, and there are methods. Now, what are the research problems? These are the gaps in knowledge that are there all around us. We just need to identify them and further study them, analyze, collect data, analyze, get results, and then see that are we right? Have we bridged the gap? Okay. Then there is data that is lying all around us. Now, what is data? So, if you walk into an OPD, okay, and just count number of patients with fever, that's data. You just look at number of children vaccinated in a school, that's data. So, data can be anything, which we will collect after we understand what is the research problems and what are methods over here. Methods over here are to answer the research problems. So what is a research process? So this diagram is a pictographical representation of a research process. So now if we break it down and write it, so this is what is research is. It is a creative systematic work undertaken to increase the stock of knowledge that is already there. And it is an expansion of the past work in the field. See, the medicine that we have now and the medicine that existed 200 years back, we can say we have evolved, but it just didn't happen overnight. It just happened over a period of time. And then we stand on the shoulder of James, who has done, the research before us. So now, research process. So now, the first step of research process is identifying the problem. Then doing a literature review. Then formulating a hypothesis. Okay, the good hypotheses are specific, measurable, and plausible. I'll give you an example for this. Now you see there's a school in which there are class 9 students. In a section, let's say in class 9B, there are 50 students. Okay, 25 male, 25 female. Out of the 50, they have 35 have complaints which you feel that are similar to a complaints that a patient in OPD would give, whom on examination you will see is anemic. So you make an hypothesis that these are anemic. Then you do a literature review. Adolescent age, yes. Anemia, what could be the reasons? Then you think that, okay, now all these people have, all these students, 35 of them, whom you feel anemic, have maybe having a helminth infestation. So you make that hypothesis, which is specific. Okay, you are specifying to helminth infestation. How do you measure it? The lab diagnosis of helminthic infections, that is eggs in stools. So it is specific, it is measurable, and it is plausible. So you have formulated a hypothesis and you have taken a right question. Now choose a study design and use the appropriate samples for the study design. That is the sample size, which I'll be covering in brief next. Use efficient study designs, which also I'll be covering next, and use the correct tests. Okay. So over here, what we do, we collect the stool samples of all the 50 students of class 9B in this particular school. So our design or our way of doing is we check for any eggs in the stools. Then we collect the data, we analyze, testing the hypothesis. Once we have done, we find, okay, out of those 35 students whom we have suspected, 30 have eggs in the stools. So what about the rest? Now you get a different hypothesis. Then you analyze, what did we miss? Then you find out the missing link, then you conclude and you publish the result. This is in a nutshell how we do the research process. So now there are components of research. There is an anatomy of research and a physiology of research. Like anatomy of the research is the research question, the design, the subjects that we use, the tools of measurements, the sample size calculation. The physiology of the research, as the slide says, how it works, like what happened in the study, how these findings generalize to the people outside the study. So explaining a bit more on the physiology of research. Now, let's say goal of a clinical research is to draw inferences. So how do you do? First phase is the designing and implementation phase, where we make an hypothesis and get a research question. Then we make a study plan. Then we do the actual study. Then there are the findings in the study from which we infer the truth in the study. That is the hypothesis and the null hypothesis, which I'll be covering later. Then we infer and truth in the universe, we draw conclusions, and we extrapolate the findings of the study to the particular population or the universe or the sample where we do. So now what is this universe first? Universe is the place where in which you are doing the study. So now let's say I am from Hyderabad. And I'll say there's an area in Hyderabad called Mushirabad. I'll do a similar study of the helminth infestation in school children in the whole area of Mushirabad. So that becomes my universe. Now I made a research question, then made a study plan, did the actual study. So once I made a hypothesis, then made a research question, then I made a study plan. So in the study plan, what we call as methodology, we plan how will we conduct the study. So do we conduct the study? The first thing is where do we collect the data from? So what are the types of data that we'll be collecting? What is the character of the data? What is the nature of the data? And above all, over this universe, we can't go to every school. So we randomly select a school. So that's through sampling. Then we get to a sample size. Then we come to the actual study. Then we get the findings. Then we see, okay, in one school we had 30 children. Okay, now we have done 10 schools. There are 300 children. Out of those 300 children, 240 have it. Then we infer it to the truth in the universe, and then we draw conclusions. So this is the physiology of research. Now, I've been talking about research questions. So how do we find, or what are the sources of the research questions? So first thing is literature review. If we see in the research cycle, the second step, that is mastering the published literature. Being alert to new ideas and techniques. How do we get new ideas and techniques? We get them by attending research meetings, conference, being attentive in class when the faculty tells you about the latest developments, or during your clinics. Having a skeptical attitude about prevailing beliefs, and applying new technology to the old issues. Now, I can give you the easiest example of it is, artificial intelligence, the various ads we see. Now, staying alert to the data needs. That is, we have to be careful in observation, teaching, and in tenacity. And then the final step, which is very important step, is choosing a guide or a mentor. So there is a criteria called finer criteria for a research question. That is, it should be feasible, which is it should be adequate and some feasible as in once you make a research question, you understand that the sample size should be adequate with you should have a technical expertise and resources to go forward in the research question. It should be interesting. It should be novel. It either confirms or refutes or extends the previous findings. Refutes, there's a story that all of you must be aware as of now that a researcher wanted to refute the claim that stress causes peptic ulcers, and he ingested a petri dish of H. pylori, or then extend the previous findings that has brought the medicine to wherever it is standing, or provide new information. It should be ethical and it should be relevant. So what are the study designs? They are cross-sectional, case control. These are observational. You observe, you don't intervene in this. Now there are experimentals where there's the intervention. Like a new drug is being developed. What do? RCT, randomized controlled trials. So one group gets it, one group doesn't get the drug. So it is an intervention. Giving drug is intervention. In observational study designs, you don't do any intervention. In experimental, there is intervention, and there are reviews called systematic review and meta-analysis. Both, if you look, from bird's eye view, may sound the same, but are different when you do it. So basically, what you do in the reviews is you go through the data, find the research gap, and see have the previous studies answered it clearly or not. That's in a nutshell. Now there is a hierarchy of evidence for the evidence-based medicine, or the scientific research or scientific temperament. On the top is meta-analysis. Now the next is systematic reviews, randomized controlled trials, then their cohorts, their case controls, cross-sectional, and case reports. So the whole thing goes up from case reports till meta-analysis. And you require for the research a basic biostatistics, that is descriptive statistics, finding out a p-value by using tests of significance. Then there are confidence intervals, which will help you to give out the results. And the ethics of the research that have to be followed is to get an informed consent from the patient, get an ethics committee approval, have confidentiality, maintain it, and avoid plagiarism. Now, the thing is how students can start. It's like you can start with the case reports, audits, surveys, and there are ICMR projects, and there are literature reviews. So case reports are any reports of interesting cases, either single or maybe a couple of them. Then there are clinical audits, and there are surveys and projects. So how can students start? First is start attending your clinicals regularly, read and then attend, go back again, see if there is any gap, then try to find an hypothesis of it. I mean, try to make an hypothesis about it, then try to get to a good question using the finer criteria that I had just gone through. Then approach your faculty. They would give you the best way because they are the best mentors that we get. The key takeaway is research is nothing but a structured curiosity where a good design matters with very good ethics, which are very essential. And the last point, every student can contribute. So while I was doing my MBBS, the initial first 2 years, I was thinking that only the toppers or those guys, those genius people can do research, not everyone. But then slowly, over a period of time, I realized that everyone can contribute to the scientific repository of knowledge that is there by doing research. You need not be in, the tertiary or super specialty centers to do research. You can start it at grassroots level also. Any questions? I hope I was audible.
Yes, sir, you're audible.
And I didn't lull you all to sleep, right?
No, sir, it was interesting.
Yeah, so I'll be sharing the presentation with Sri Varsha, and a very good step by NMO Telangana to start this series of lectures, and good luck. Over to the organizer.
Thank you, sir.
Thank you, sir. Next, Dr. Nayan Sriramula sir will talk.
Yeah, hi. Can you see me? Hello.
Yes, sir, you're visible.
Right. So I'll just I'll share my screen. I hope you can all see the screen.
Is my screen visible, Dr. Varsha?
Sir, it is visible, but it's loading, sir.
Yeah, it's taking some time to load. So anyway, while it loads, I'm Dr. Nayan, and as Dr. Varsha, I'm getting a resound. Dr. Varsha, can you just mute? So I'm Dr. Nayan. I'm head of department at Medicor Hospital. I'm MD DNB in emergency medicine. So emergency medicine being a new field, and I don't think most of you would have met an emergency physician who's MD emergency physician, because at undergraduate level, most of you might not be accustomed to this, but we are here for the last 15 years, and I think this is better instead of the screen slide. So is this clear, Dr. Vasha? Okay. So
Yes, sir.
my lecture is similar to what Sir has discussed previously, but I'm just having fancy slides. That's all. But I'll try to make it little interesting and a little more different than what Sir has mentioned. Most of the things are the same because the basics of clinical research are all being discussed in the previous lecture. So the thing is, why does this matter? Like the first speaker has told about the multiple sclerosis case. So if you have to take the day-to-day example of CPR, so the CPR guidelines tell us that the survival chances are improving with CPR, and every 5 years or such, so we get new guidelines that you do so much time for CPR, or you use this drug for CPR. Previously, they said you use atropine. Now they're saying you use adrenaline. So this is coming from clinical research, and this is all evidence based. So clinical research is a bridge between the lab and the patient care and outcome. So this is where the gap is, and this is filled with research. So how you diagnose, how you treat, and how you prevent, everything is what your clinical research is. So there are types of clinical research. One is, you are broadly, if you can classify, there is observational one and there is an interventional one. In the observational one, we just don't do anything. We observe without influencing or intervening. Like first is, for example, it's a cross-sectional study. We are observing a population at a single point in time. And there is a case control study. So the name itself says case and control. So it compares the cases to the controls, which are the normal or the non-changeable population group. Then there is the cohort study. Cohort follows a group of people over time to compare outcomes between exposed and unexposed group. So the classical example is I think we have all heard about the Framingham study, the cardiac study. So this is your cohort study. So the interventional studies are where the researchers actively intervene or assign treatments to study their effect. Randomized control trial is one of the example where we do randomization, we assign randomly, and then there's all kinds of things which maybe we'll discuss, the double blinding and all the techniques for randomization. But just remember that randomization is where we allocate randomly to groups. It can either be the control group or intervention group. So next is the research question. So this was also explained very well. So there is, first thing, the question needs to be developed. How do you ask a question is very important in clinical research. So if you want to ask a question, you cannot be very vague. You cannot just say, I'm studying about headaches. So this finer criteria helps you define your question well. Feasibility, it should be interesting, it should be a novel thing, it should be something new, it should be ethical, and it should be relevant to your real world settings. So these are how you frame the foundation of a good question. And after this, you then go to the next important thing for the question or the study, which is the PICO criteria. So the PICO is patient or population, intervention, comparison, and outcome. So every study should follow the PICO framework. So let's say want to do a study of acute migraine, and we want to see if a use of triptans compared to NSAIDs can reduce headache recurrence within 24 hours. So this is your research question, right? So how is this study framed? First thing is your population. The population will be the adults with acute migraine. Next is your intervention. Intervention is early use of triptans. Then the comparison group, which is NSAIDs, and the outcome. We want to see if there is any recurrence within 24 hours and reduced headache. So this is your PICO. And if you combine this, there will be clarity and there will be a focused research question. So next example we can take is, let's say, does oxygen help MI? This is a very vague question and very non-specific. So if we apply PICO for this, we can come to a better question like, does oxygen therapy reduced mortality in MI? So population acute MI patients, intervention is your oxygen therapy, comparison is no oxygen therapy, and outcome is your mortality. So it will give you more meaningful answers. So every study should have a design flow. From the beginning of an idea, you have to get an idea first, then you make this idea into a question, and then you frame this question. You design the entire study, how you want to study. Is this a case control? Is this an RCT? And then you collect your data, analyze this data, and you conclude, interpret the results, and you discuss. This is how you design the study. In this design, we have the population and sampling. So whom are we targeting? Same for the PICO. First is the population. The target population is in the same example where the oxygen for the acute MI cases, if you take, your target is the adults with acute MI in emergency department. So this is the entire target population, and the study population is the subgroup where you are taking after excluding few people. So adults with acute MI in the emergency who meet inclusion criteria and consent to participate. So this is the main main population. So the excluding few factors from the target population gives you the study population. So what is inclusion criteria? What is exclusion criteria? So the inclusion criteria must be those factors which should be included in the study, like adults above 18 and less than, let's say, 65, and you ensure they're relevant to the research question and improve the reliability of study. So exclusion criteria is where the participants should not have these qualities. We don't want any trauma patients, accident patients. We don't want any pregnant patients, or we don't want people who are too old. And then there comes these risk factors also, which can compete for oxygen. So we want to study the association with acute MI and oxygen. But if you're taking COPD, or if you're taking a patient who requires oxygen, then it will cause confounding. So we'll discuss what is confounding next. So there is something called as bias. If you have to remove this bias, that is your target. So bias starts with poor selection. So what is bias? Bias is basically systematic error that can lead us away from the truth. There are different types of bias. One is the selection bias, information bias, and recall bias. Selection bias, it occurs when the participants are selected for this study are not represented or not the exact category. So you're not selecting some other different types of people, right? So let's say, for example, I'm there on duty 9 to 5, and I'm selecting only those people who are coming to my for the emergency department for 9 to 5, and I'm excluding all those who are coming in the night. So this is selection bias. I don't want this selection bias. Or let's say somebody has a thing for females, so they are only taking females in the study. So that is selection bias. Next is the information bias. It occurs when there are difference in how the data is collected, measured, or recorded. This is information bias. If you take samples from different hands or legs, the BP machine, if you take BP collection from different hand, leg, and you enter them all, then it becomes a information bias. Or if somebody is collecting information in different way, that is one of the information bias. And then recall bias, if you ask them a question about risk factors and then they don't remember their past smoking or drinking habits, then it might change the outcome of the study. So this is bias. And then there is confounding. This is the hidden variable that misleads entire study. If you are, let's say the next study is when we want to see the smoking, I'm sorry, when we want to see the good association of coffee drinking with cardiac protectiveness. So some studies found that coffee drinkers had lower rate of heart disease. So this is what we want to study and observe. But here the variable is, many people who drink coffee, they enjoy a cigarette. So while having a sip of tea or coffee, usually people smoke. And this smoking is a confounder, and smoking is associated with heart risk, and it negates your protective factor of coffee. So conclusion is, end of the day, if coffee is added with smoking, then it will reduce, doesn't give any protective effect, and in fact damages more. So this is the confounder. Let's go to the basics of statistics, which you all must know. So the statistics is very complicated, and even I don't like statistics very much. I most of the time try to outsource or find a statistician to do it. But we must, of course, to read a paper at least, we should know the basics of statistics. Otherwise, these days, ChatGPT or any AI tool can do statistics, but we should know what is correct and what is wrong, because AI keeps giving you wrong answers all the time. So let's say the median and mean. We all know what is a mean. Mean is actually an average of all the values. So a median is the middle value when the data is arranged from smallest to most largest number. So this is median, and we can check for outliers and skewed data for with this. P-value, we have all heard about p-value. I mean, if people who are doing MD in their thesis, whatever statistics they do, they just write p is less than 0.05 and the study is significant. So that's all. And rest all doesn't matter. So here, sir has discussed about null hypothesis and alternative hypothesis. So the p-value is the probability of getting results, and we assume that the null hypothesis is true. So if p is less than 0.05, we reject the null hypothesis. So result is statistically significant. And if p is more than 0.05, we fail to reject the null hypothesis, and it is not statistically significant. I will discuss in the next slide. So there is confidence interval. Let's say, simply speaking, if we repeat this study again and again and again, it means if the study has 95% confidence interval, it means that if we repeat it again and again, then the whatever results are there, it will be the same. So that is confidence. So with this much 95% confidence, I can say that so and so study, so let's say the true population mean lies between 10.2 to 14.8. So that is what they're saying. So that is your confidence index interval. If it discuss the range, what is the p-value? P is the probability value. Probability value, if I have to explain it to you in a simple sense, let's say a coin is there. If I have to flip a coin, I know that there is 50-50 chance of getting either heads or tails. But if the coin is flipped and 10 times out of 10 times it is showing heads on the 9 times, then what does this mean? Does this mean the coin is biased? So it is biased because it doesn't happen always. So there is a high unlikely to happen by chance, and the coin is probably biased. So the p value for this is very small. And let's say if the p value is large for this theory, hypothesis, then it means that we cannot conclude the coin is biased. So that's just a small example. So I think it will confuse you more if I go into what p value is not. So let's just keep it this way simply, so that you can think about it and read more about it, so that you can understand it in your own way. So the variables and outcomes. There are cause and effect. So what are independent variables and dependent variables? So variables are something you can change. Independent variable is the factor that is changed or manipulated by the researcher. It is the cause. And what brings after changing this is the effect. So that is your dependent variable. So what there are types of variables, like there are binary and there are continuous. So the binary is categorical. So has two possibilities, like yes or no, male or female. So next is the continuous. Here, these are within the range, like there's a blood pressure range, body temperature range, all of these. We change the independent variable to see its effect on the dependent variable and choose the right type of variable for an accurate analysis. Like ethics, we have already seen, we need an informed consent, we need an ethics committee approval, we need to always put patient safety first, and we need to be first do no harm. Levels of evidence, if we see, the highest level of evidence is meta-analysis, systematic review, and then comes the RCT, then the observation studies like cohort studies, and then the case series. So what does this mean basically is that if I have to trust somebody saying that they have found a drug cure for cancer, somebody saying I have found a cure for cancer and this is my case series, is this very good level of evidence compared to a meta-analysis? So meta-analysis should be trusted compared to a case series in such matters. In such very shocking discoveries or anything for that case, any research, if you compare it to a meta-analysis or a case series or a cohort, you have to take it with a pinch of salt, because people these days, there are multiple journals which want to sell their journals subscriptions. They are going to tell you very astonishing results, but you have to know how to read a paper first to understand and evaluate, is this even written by a good researcher, was this done properly? Because people just do a lot of plagiarism, lot of copy paste. So how do we read it? First thing is, we have to read the abstract. Abstract gives you a basic snapshot of entire paper, helps you decide if you want to continue reading or not. So first thing is, you look for the background of the study, objectives, all of them. Then you go and next is the methods. This is very important, because if you have to know how did they conduct this study, is this uh, a good study or not, you can see by the method. So what is the sample size? Is this a single center study or a multi-center study? How many people were included in this study? What was the inclusion exclusion criteria? Everything will be mentioned here. So if you find that they're saying they found a cure for cancer, and then saying that it was conducted in 50 people, that is a bullshit study. So you need to have a good study design to claim a result. So the results are again very statistical. The column is very statistical without any interpretation. So it will tell you the data, how it was done. And next is the discussion of this result. So here also, in the discussion part also, the author will try to twist his words and, just yes, maybe, All of these neat PG type of question type of words will be used. So they will try to twist them and make it look very appealing. But end of the day, you need to have a knowledge to understand what it means, right? Because in the class tomorrow, maybe your professor will only say that this is a very good paper. But you should know for yourself, is this a really good paper or is this a blotched study? So common mistakes in research, it is actually a chain reaction, because a machine requires all the parts to be moving correctly. So first thing, if you fail at a poor question itself, then your entire machine will stop moving. And next, the small sample size, you don't have a proper methodology, and then you ignore the bias and the confounders, and you rely overly on the p-values, the statistics, and all of them. Then it is doesn't guarantee a practical significance, and end of the day it is a failed outcome. So students can start by reading case reports, unique cases. You start collecting them, you start doing publishing them in a local journals or your college journal, and then you participate in quality improvement audits or simple audit, and then slowly go to a observational study. So like sir has said, you participate in the study groups, the research groups, all of these. So take home message is curiosity should be developed by thinking about research questions. You form the research questions in your mind, everything you see. If you see a small thing like a light bulb, so it's just small research question in your mind. Why is the light bulb white? And what is the benefit of having white light to yellow light? All of these you need to form in your mind. Next is every doctor should understand research. It improves decision making, because if somebody says it is written in Harrison 21st edition, and then you read a paper which is published in Lancet, you can tell them that, see, Harrison textbook is a good book, but it doesn't mean that it is not it is research is not evolved. So we need to always be updated. We need to know what is right, what is wrong, even though it is written in the Bible of medicine. So next is start small but think big. You keep learning, and small, very small, like a case report today can be your meta-analysis tomorrow. Right? Thank you very much.
Thank you, sir.
So if anybody has any questions, they can ask me. Over to you, Varsha.
Any questions you can ask us.
So proceed to another speaker.
Dr. Prashant Kokiwar sir will continue the next.
Good evening, all respected dear students. So I have been asked to talk about ethics in medical research. So are you able to see my screen?
Yes, sir.
Okay. So nice to see more than 40 students in this particular forum, and I'm happy to see that many are interested in the result. I hope I am clearly audible.
Yes, sir.
Okay, thank you for confirmation. So we will start now with once again Namaste to everyone. And topic is ethics in medical research. So, what is medical ethics? Is a disciplined branch of moral philosophy that examines the values, choices, and duties involved in healthcare and medical research. Rather than providing a simple yes or no to every dilemma, it offers a framework of navigating the gray areas where professional obligations and human rights intersect. Okay, so as all of you know, this is quite technical, but generally ethics, if we want to explain in simple words, is a principle of research and an important domain. So whoever does the research of whatsoever kind, there is no excuse. You must follow the ethical principles. So these principles basically include that you should not harm the patient or the participant in any matter, like physical harm, drug reactions, or asking sensitive questions where the people may get hurt, or having some interaction which can disturb the patient emotionally, or the participant may not be comfortable. So even if such questions are there or certain drugs are there, you are supposed to explain the participant that probably this is a new drug we are doing experiment, and it may cause some harm, but we will take care of you. If anything happens, we are there, our specialized team is there, our hospital support is there, they will take care of you. Like this, after explaining everything, we ask the patients to, we ask them whether they are willing to participate in the study. So this is the basic procedure, basic thing, basic objective about ethics in the medical research. So ethics means like, this is one part of the ethics is informing the patient about the study risk and any benefits, any advantages, any disadvantages, any drawbacks during the study. So you are supposed to explain everything in the language the patient understands. Then you should ask the consent, take the consent of the patient in the language the patient knows. Then you have to inform that the patient is free to leave that study in between. In between also the patient is free, or he is free to not to answer any question in between. Suppose he is not comfortable, he will not answer the question. So we record it as no response. So this is the part of ethics, informing everything about the study, not hiding anything. Before we start the questionnaire or clinical history, clinical examination, investigations, and any kind of drug trial or interventions or counseling sessions. So we inform everything till the outcome to the patient, and we ask his consent. So this is second part of the ethics. Third is if the patient is diagnosed with a particular condition, then he will be taken care with the minimum expenditure that the patient can afford, and or the investigator is ready to bear through funding or something. So just like that, many people, they do research, they use the people like guinea pigs. For example, most common research is malnutrition among school children, or identifying hypertension among school children, or to study the prevalence of anemia among school children. So after you found that out of 100 students, 65 are having anemia or 45 are having anemia, whatever the result. Next ethical question arises. You followed everything, you informed the teachers, parents, you have taken the child consent. But third part is very few people complete. That is giving the benefit. Those who are identified with anemia, what you are doing for them? Are you giving iron folic acid tablets to them? Or at least you are not able to give? Are you able to refer them to the any hospital or any primary health center so that they can get the free distribution of iron folic acid tablets? Those who are found to be hypertensive, are you talking to their parents that your child is probably hypertensive, needs to be confirmed in the hospital by the physician, and if it is confirmed, you may need to have some further management. So that is that is important part of ethics that is generally not discussed in the ethical classes. So giving the complete benefit to the patient after the study is over, and maintaining the relationship with the participants as far as possible. So that is also important part of ethics. So there are 4 pillars of ethics: autonomy, beneficence, non-maleficence, and justice. So autonomy is patients, as we have discussed, patient will decide whether to give the consent or not. Informed consent means you are informed everything about the study. So it is the right of the patient, and he can leave the study at any time. That is called as autonomy. Next is beneficence, that what I just told you, giving the complete treatment to the patients even after the study is complete. Those who are identified with some problem, giving them some health education, counseling, or treatment management, referral to the hospitals. So non-maleficence means no harm, not to do any harm. So it means we have to work on the things that we should minimize the risk, side effect, and harm. That amounts to physical harm, social harm, emotional harm. So we should not harm the patient during our research. That you have to take care. And justice. So requirement that medical resources, burdens, and benefits are distributed fairly. It prevents exploitation and advocates for equal access to care. So you are doing a research, you have to do the justice as ethical principle. So these are the 4 pillars. Then key concepts in practice: confidentiality. Already you know that you are supposed to keep the patient information confidential. You should not disclose his identity, like name or his residential address, his registered number or roll number if you are doing among students. So you have to take care, you have to assure the participants that the anonymity will be maintained, confidentiality will be maintained. Then next is fidelity, that is faithfulness to one's professional obligations. So participants should feel a trust in the researcher, principal investigator. Then veracity, it is to be completely honest and transparent. That is what already we have discussed. Whatever is happening or any side effect can happen, it should be completely disclosed and it should be transparent. And as I said earlier, it is a duty of care, legal obligation to provide a standard of medical care. how the medical ethics has evolved in 1947. Nazi doctors were conducting horrific experiments at a place called Nuremberg, and they did not take the consent of the people. Because of they did not take the consent, many people suffered lot of injuries and death. So in 1947, a committee was formed and they have decided that after the horrific incidents of Nuremberg, it is important that we should develop some code of ethics, and it is called as Nuremberg Code. Why? Because so that we'll remember that dark period. The Nazi doctors conducted some experiments in which the consent was not taken. People were not informed about the experiments and they suffered a lot of side effects. So to remember that and to make the consent mandatory, consent means patient's willingness, whether he is willing to participate in your research or not. So this is related to the consent. Then Tuskegee syphilis study 1932 to 1972. For 40 years, US government tracked untreated syphilis in black men without their consent, and they did not provide available treatment. So this led to a massive overhaul of US federal laws. So after this, it was taken seriously, and in the medical ethics, it is made mandatory that the participants' informed consent must be taken and they should be provided with available treatment. The thalidomide tragedy in 1950s-60s, a drug marketed for morning sickness, caused thousands of babies to be born with limb deformities, is a proof of safety and efficacy before any drug hits the market. So these were the basis of evolution in the medical ethics, because we learn from the mistakes. So that is how the humankind evolves over the period of time, learning from the historical mistakes and deciding not to repeat them. That is called as evolution. So that is why global gold standards, Nuremberg Code defines informed consent. Declaration of Helsinki 1964 shifted focus to the physician, research and duty to the patient. That physician and researcher, they are responsible towards the patients. The Belmont Report 1979 established 3 core principles: respect, beneficence and justice. So patient should be respected, benefit should be given, and it should be justified. Now coming to the consent, there are different types of consent. One is implied consent, that is when the patient walks into the hospital, indirectly when he registers as an outpatient, so that indirectly he gives consent for all the investigations. So that is called as implied consent. Next is expressed. So this implied consent is not the part of research. Please remember, we are just seeing the different types of consent. Then express consent, that is a clearly and unmistakably stated, leaving no room for doubt. That is verbal or written. So these 2 types of consent are usually in the daily routine practice in the hospitals and nursing homes. Now for the research, we have to take the informed consent. So in this, the researcher discloses all the things, what are the risks there, what are the benefits, what are the alternatives. And the participant should be competent mentally, physically, so that he can give the consent. Then that person should understand what information you have provided, that is called as comprehension, and voluntarily he should take the decision. So first, disclosure that is done by the research worker regarding the risk benefit and what are the alternative treatments available. Then the participant must be competent mentally, physically. Then he should understand and he should voluntarily give the consent. So this is how is the part of informed consent. Now, when we do the research in the mentally handicapped people, they are not competent. So what is the procedure there? Or children are not competent, right? Because they don't have legal capacity. So in that situation, what should be done? Because if you are doing a study on infants, then they are not in a position to actually understand what information you provide to them, right? And they cannot make a decision. So that will have a different population, different type of consent. So this informed consent is on whatever given in this particular slide will apply only to the adults above the age of 18 years and who are mentally fit, physically fit, who understand the information and who are in a position to give the voluntary consent. That should be clear. Okay. Then special types in research like broad consent is a consent for an unspecified range of future research like biobanks. Suppose you are doing any research work on using the biobanks or the organ banks are there. Okay, so that time you have to take a broad consent. That consent is called as broad consent. So that biobank in charge will give you the permission. Then tiered consent that provides a checklist of options allowing participants to choose which part of the study they join. So this is done in the complex studies like genetic testing, data sharing, or tissue storage. Then we have dynamic consent, that is, it is a personalized digital approach where participants can update their consent or preferences in real time. So this is applied to long-term longitudinal studies and digital health research. And consent deferred, consent obtained after an intervention used in emergency setting where immediate action is required to save a life. So that is called as deferred consent. So yes, there are certain situations where you can't take the consent. If you go behind consent, probably patient may die. So in that, if you are able to justify such situations and you are competent to handle, you can defer. You will not take the consent. You will first do the procedure and then you will inform to the patient or his relatives. So that is called as deferred consent. Then what I said, children, then
Sir.
yeah.
Sorry to disturb you, sir. We are running out of time. Can you please fasten a little bit?
Yeah, definitely. 1 minute. Okay. So here we will. What is important in medical research is first is informed consent. Okay, this is very important. This is commonly done, and then assent. So we do the research in children below the age of 18 years. That time we call it as assent. We do not call it as consent. So it is an official consent from the parents or guardians. Okay. So in regular research practice, we are using written informed consent and assent. So I wanted to tell what is the procedure for medical ethics. Once you are ready with the protocol, you should submit to your college scientific committee, present the protocol. If there are corrections, you submit again, and then you get the approval letter. Then you submit it to the institution ethics committee. Then you will be given the time to present at the ethics committee. They will suggest some corrections, and after they are satisfied, they will give the approval letter, and then you can start the data collection. So after completing the study, you are supposed to submit the final report to the ethics committee, and if you have published your research, you can submit one copy to the ethics committee. So in case of any changes occur after the ethics committee approval, in your title, in your questionnaire, in your methodology, you are supposed to inform to the ethics committee. And if required, you have to present again and get the changes approved. Then what documents are required for scientific committee is application and protocol. Documents required for institutional ethics committee is application, scientific committee approval letter, protocol, informed consent form in English, Hindi, Telugu or any other language if the participants speak that particular language, patient information sheet in all above languages, and study questionnaire. So all these formats will be available at your respective college. So you should contact the ethics scientific committee and ethics committee. They will provide you the formats. You fill up the formats. You can contact them for details, and they will help you to fill out the things, and then it can be done. Okay, so this is the format that I have. Anybody having any questions? Thank you.
Thank you, sir. As we are all running out of time, let's conclude the sessions in 5 minutes. I'm Dr. Akhila, PG first year, GMC Siddipet, a community medicine resident. I'm Sahavidyarthi Pramukh for the NMO Telangana state. Today, my session topic was how our NMO Telangana will help the students and your complete roadmap. Basically, we started this research thing to help all the medical students about how to submit the research and inculcate the activity. So what we are doing is we'll take from next to 5 to 7 days, think about any research idea you have and submit it, like the title 2 to 3 line and basic line via Google form. We'll share you the Google form and you send our title and line submission, any of your thesis topic. If as you're already attending the session, I think you're already interested in the research. So please, with the title and 2-3 line, enter the questionnaire Google form via Google form and participate in that. After that, we will take the Google form, and the selection criteria is very fair and transparent based on feasibility, data availability, clarity of objective, and team commitment. We will select from each college, and you can be in a group also. From one group, 2 to 3 people can be selected, or you can form a single group also, and then mentorship. You're just not alone on Vata. In every college we'll connect you. If you guys are really interested, we'll take 2 groups from every medical college in all over the state and connect one PG resident or senior resident or faculty member over there who will mentor you over this research and how to do it, manuscript writing, an idea, study sample, everything. So they will mentor you the research on Mata. In this way, you will have a close relationship with your professors and the seniors also over there. So basically, execution. This is a small study, simple designs. Whatever you have, develop a protocol, and then we'll look after it. After that, we'll submit to ethics committee with simplified guidance, and then we'll tell you the timeline period where the data collection will be going on, how you're filling Google form and everything. We'll let you know. For this 1 week, I request everyone to send your title projects via Google form, and then we'll follow up with you by connecting all the professors and senior residents in all the college. And then this doesn't stop just here. After completing your research and whatever it is, you'll have presentations. You can present your research in conferences, even in journal. This also help in your CV or career boost. So in this manner, let's inculcate all this research methodology in our group. And then this, what happens, thanks to as we are all running out of time, please ping us in the NMO Telangana Instagram or Sri Varsha or Madhusudan for any of the details. This is what we are working on. This is actually a very new project for Telangana. We are new to it. Let's work together as a one family and then proceed. This is what I had a very good mentors for the research. I want every of you of my juniors to have the same thing. This is what I require. I wanted to do this. So if any of you guys really wanted to do research, learn from research, NMO Telangana is open platform to you guys. It will help you. We'll connect you to the mentors, and then we'll all together. We have NMO journal also. We'll submit our research after ethics approval and everything, scientific approval, as sir told, there are certain protocols and guidelines we have to stick to the research. And then I like to conclude this sessions by thanking speakers who attended this. First speaker, Dr. Kumari Angadi sir, who is also our NMO General Secretary, All India's General Secretary, Dr. Ravi sir, Dr. Nayan sir, and Dr. Prashant Kokiwar sir, for attending a session and giving a valuable inputs to our students. And then as I tell you, this NMO Telangana organization is like a family. There is no hierarchy over here, just a plain guidance. We like to be like a family together. So please feel free to approach us. And then we'll be having different sessions on research methodology. After if you guys submitted the Google questionnaire, we'll follow up with you, and then we'll proceed how to conduct another session. Or if anything you want more to be added or want more to be helpful for you, please let us know. We'll make another session on it. Thank you, guys. That's all. Varsha, can you conclude this session with Shanti Mantra? If you guys have any, I will share all the PDFs and PPTs in the group. If you have any doubts, please ping us. Now also you can ask me. I'll open for 1 minute and then we'll conclude the session with Shanti Mantra.
You guys also can give any kind of feedback after the end of session in the group.
Thank you, everyone. Shanti Mantra. Yeah.
Yes,
Yes,
ma'am.
sir. Okay. Shanti Mantra. I request everyone to sit straight. Sarve bhavantu sukhinah. Sarve santu niramayah. Sarve bhadrani pashyantu. Ma kashchid dukkha bhagavet. Om Shanti Shanti Shanti. Thank you, everyone.